We have a quorum. So the first topic on the agenda tonight is to review, approve, and sign the minutes of the June 8th meeting. They were distributed by email. Has everybody had a chance to review those? And if so, could I have a motion to approve the minutes?
Motion to approve.
Do I have a second?
Sure, I'll second.
Okay, all in favor?
Aye.
I am abstaining because I wasn't at the meeting. Okay, the second issue on the agenda is a complaint, an open meeting complaint received by the board chair on 7/08 this year. So we're gonna have a discussion regarding that, and we're gonna decide how we're gonna comply with the, or respond to the Attorney General's office. I do want to say about receiving the complaint on 7/08. I've reviewed my emails. I was expecting I would think that I was going to get an email from the town clerk. I went back and looked, and I found an email from the Board of Selectmen, Mr. Crowley. And so I was emailed there. I'm a little disappointed that I think that the office, we have a clerk, secretary or assistant, and that email should have been made part there. I think in part, some of the issue was there was a change in leadership. Nancy retired, and Jim took over some days later, and I think it just fell through the cracks. Nevertheless, we're going to discuss it tonight and come up with a response. So I want to open it for discussion. I want everybody to be courteous, civil. The complaint seems to be directed more at Dr. Sullivan, so I'm going to ask him to open up the discussion, and we'll go forward from there. So, John, you're on.
Thank you, Mr. Chair. Yes, the complaints were specifically directed against me, John Sullivan, and Mr. Crowley suggests, as there is a repeated disregard for open meeting laws, John Sullivan should be fined and removed from the Board of Health. So I thought it was reasonable to respond to that. And this is my response. On June 7th, the Select Board member, Crowley, filed 2 open meeting complaints about me based on emails I sent on May 13th and May 16th. I will deal with the most trivial of the 2 first. The May 16th complaint. My email on May 16th was a response to Margaret Lee, the Board of Health Administrator, regarding an email she received from Sherry Tangri, tobacco specialist, Worcester Department of Public Health, who assists us on tobacco regulations. Ms. Tangri asked that we address tobacco permit suspension guidelines at our next Board of Health meeting, with the specific issue of how long to suspend a permit with the first violation. Margaret asked how we should deal with this, which I interpreted as what timeline would we suggest at our next meeting. I responded, 3 days sounds minimal, I would suggest a week. That was my entire email response, which is the basis of this complaint. The May 13th complaint. On Friday, May 13th, I was reviewing the week's COVID-19 data in our community. During that time, the Omicron 2.12 variant was surging, and West Boylston was in the CDC red zone or orange zone. I'm colorblind. The highest transmission rate based on cases in our community. 46 cases in the last 2 weeks in West Boylston. The Blackstone sewage analysis was reporting 1.4 to 1.5 million copies per liter of sewage. UMass Memorial Healthcare was admitting 25 to 30 patients a day with COVID-related illness. We were scheduled to have a town meeting on Monday, May 16th at 7 p.m. in the high school auditorium. I was concerned as our town meetings tend to attract older individuals like myself, and the high school auditorium has what I would call poor ventilation or air circulation. In addition, on the warrant was an article to fund a food service employee for the senior center, which I thought would encourage more attendance by our high-risk elderly. With all these facts in mind, I sent the following email to our Board of Health members and the town administrator. Colleagues, as we know our COVID cases are up, we are in a high-risk category by the CDC, and the Blackstone sewage is running at 1.4 to 1.5 million RNA copies per liter. UMass Memorial is admitting 25 to 30 patients a day for COVID-induced illness. I am a bit concerned about Monday's town meeting being in a poorly aerated auditorium. It would be best to have it outside, but if that is not feasible, we should require masks to be worn. I would appreciate each Board of Health member weighing in on this. Thanks, Sully. 3 members weighed in with suggestions to move the meeting outside, to require masks, or to make citizens aware and offer masks at the meeting, which is what we ended up doing. One Board of Health member raised the issue of open meeting law, and I responded stating that the Massachusetts general laws allow the boards of health to respond in an emergency. SARS-CoV-2 Omicron BA.2.12 variant without a public notice or hearing. If the Board of Health determines that an emergency exists, the board or its authorized agent, acting in accordance with Section 30 of Chapter 111, may, without notice of hearing, issue an order reciting the existence of the emergency and requiring that such action be taken as the Board of Health deems necessary to address the emergency. The Board of Health shall comply with local enforcement emergency procedures set forth in department regulations as amended from time to time. I have given you the essence of the Select Board member Crowley's 2 complaints, naming me as the violator and asking the Attorney General to find me and remove me from the Board of Health. As a historical note, when the Delta variant was surging last summer and the Board of Health passed a mask mandate, a complaint was lodged with the AG's office by a town business owner. While we were never found by the Attorney General's office to have violated the open meeting law, we did have another meeting and revisited the mask mandate on September 8th, 2021. This meeting was attended by several citizens, Select Board members, and the town administrator. Following much discussion, including comments by Mr. Crowley against the mask mandate was again voted in by the Board of Health. Right after that vote was taken, Select Board member Crowley jumped up and left the meeting before the meeting was adjourned and shouted as he was going out the door that as a Select Board member he would do nothing to support the mask mandate. Within a few weeks, Worcester and most of the surrounding towns had followed our lead and implemented a mask mandate. In fact, I would say the director of the Worcester Public Health Department, medical director, actually sent me a personal note thanking us for following the lead with a mask mandate. Mr. Crowley has tried to have me removed from the Board of Health and recently voted against my reappointment to the Board of Health. I believe these 2 complaints to the Attorney General's office are additional attempts to get me removed from the town of West Boylston's Board of Health. I am not paid to do this, and I volunteer because of my expertise in virology and immunology and medicine, and I think I can make a contribution to the town. Thank you.
Thank you, John. Okay, so John's made his statement. Tom, would you want to weigh in on any of this, or?
I don't see any basis of the complaint regarding the tobacco regulations. I mean, it's just a simple set the agenda right, not conducting any kind of survey of the board. And secondly, with the second complaint, if we can't respond to something that we see developing in the community and work in a fast measure for something that seems to be a public health risk, what is our functioning as a board? We need to pick up this data early and to act early, and many times we don't have time to wait for any type of delay in scheduling an open meeting before making a decision. So I think that's what a Board of Health does.
Chris?
You know, to be frank, I considered bringing the mask one, up at the meeting after these emails went forward, but I decided since the town meeting happened, went off without a hitch, there's no point going back into the past. But I do have a few things I want to say about that. So the first one is when I was appointed to the board, I had no idea what an open meeting law was, except that I had about a 2-hour session I had to sit through to learn about it. And quite frankly, it was two of the most tedious hours of my life, but I learned. And I came to understand why we have open meeting laws, what the purpose of them are. And as irritating as it may be to sit through those, usually there's value behind it, and I'll address that in a second. If I'm going to be a part of a board, I want to be a part of a board that does things the right way. And I think that open meeting laws really are at the heart of integrity when it comes to a town board, especially when you have unelected people who aren't held accountable in the ballot office, right? In the ballot box. Second thing I want to say, one of your emails, John, which was a direct response to me, maybe a little bit of a snide remark, but definitely a learning opportunity for all of us. When I had responded to your first email saying it was an open meeting violation to call for a vote on what is a mask mandate, even if it's a one-time thing, it is a mask mandate that affects the people of the town. That's an open meeting violation. You responded saying that it was a health emergency. But before you made that point, you said it's hard to think like a lawyer when you're a physician thinking about what's best for people. And hey, God bless lawyers. I'm not one. I certainly don't think like them. And God bless you for being a physician and for having your heart being in the right place, wanting to protect people. But a board should be thinking first and foremost, not as a lawyer, not as a physician, as a public servant. And if you have the skills of being a physician, that's why you're on the board, and you need to bring those with you. But it's thinking as a public servant. And when we violate open meeting laws, we're not being public servants. We're not being accountable to the people of West Boylston, and quite frankly, we're not respecting their rights as fellow residents. So when we think about the idea of putting in a mask mandate to attend a town meeting, we're saying if you don't play by my rules, and I'm not an elected official, and I'm not even playing by the rules that I have, you don't get to participate in the political process. And realistically, May 13th, 2022, town meeting wasn't a life or death case when we typically think of the word I'm about to use, but it is a lowercase t example of tyranny, saying I'm not an elected official, I have rules I have to play by, I'm not going to play by them because I know best, and if you don't follow my lead, you don't get a say in your town. There's something wrong with that, and we need to address that, and we need to move forward not doing things like that.
John, did you want to respond?
Yeah, again, the emergency wasn't the town meeting. The emergency was SARS-CoV-2, Delta, BA2, Omicron BA2 1.2. That's the emergency. And I will always act in the best interest of the health of the community, not as a public servant, but as a public health person.
To say that May 2022, no one in America knows what's at risk if they go to an open space for a meeting is ridiculous. There's no emergency at this point in time that says, hey, we get to break the rules to decide what's best for you.
Okay.
Can I?
Chris, I just want to point out something. If you come to UMass, to one of our research buildings today, we're all wearing masks because the powers to be have suggested that we have enough SARS-CoV-2 in the community that no one working in a research laboratory can not have a mask on. And that's the way we all work. So I'm not sure you really understand what's going on.
I'm quite confident that research labs, health facilities have had a mask mandate since the very beginning when Governor Baker put one in. West Boylston saw fit to follow in the rules, remove that mask mandate, and to arbitrarily say, hey, since I have to wear one at work, you all now have to wear one to come to your town meeting, is quite frankly ridiculous.
Okay,
We disagree.
okay, that's fine. Tracy?
Yeah, at the very least, most of these things are minimum standards, and we're here to protect public health. I'm not here to debate taking away people's liberties. I'm here to protect public health. Every time I walk into this building, my agenda is to do what's best for the community, not to worry about people's civil liberties. And I think you've taken the conversation far afield of what the essence of the communication was about. It was about protecting citizens in this community, not at the very bottom level, but 3 steps up the ladder, so that there weren't any unintended consequences. And you're very new to this, and that's great, and you want to, make your mark, that's great, but this is about public health. This isn't about civil liberties.
Okay,
May I respond?
yeah, briefly.
Tracy, I love where your heart is and where John's heart is in wanting to protect people. We could have our debate about masks. Actually, my first meeting, I called for a robust, let's do the research. We all have a month, and let's have a robust debate based in the scientific literature about masks. No one ever brought anything. I was very prepared to have that conversation. Yes, we need to promote public health, but we have to do it the right way. And we can't compromise on that doing the right way, or we lose all legitimacy.
Did you not
And
hear,
we don't have a
though,
point.
John
Let him
recite
finish.
the information that we have the authority?
I
What part?
contest that 100%. It was not an emergency that Monday. That wasn't the case when we got rid of the, why didn't you call for a mask mandate, period, the end for the town weeks before that? The numbers were very consistently in that range in the BioBot report.
Okay.
It wasn't an emergency that night. So to say, hey, let me pull this loophole doesn't mean we get to violate open
Okay.
meeting laws.
Chris, fine. Tracy, you all set? Okay.
Can
No, I do want to weigh in on this myself. I've been studying the open meeting law, and as I see it, that in part, there was a non-intentional violation. That is that if the board acted as it did, but it was not an intentional violation. The questions I have are what is actually a violation? Is it the serial discussion? And as I read the regulation, it's a serial manner in order to evade the application of law. And in both cases, I don't see that that there was an intentional violation, and that there wasn't really an effort to evade the law. Nevertheless, the courts have held that the open meeting law applies when members of a public body communicate in a serial manner in order to evade the application law. I'm not sure we tried to do that. I think that there was some legitimate concerns regarding the health and the welfare of the community with regard to the open the town meeting and the issue of virus. The previous town meetings, we had held them outside, which seems to have satisfied the medical order to stay a distance from each other. The auditorium is a very closed facility. Nevertheless, while we might have differences of opinion, I still have to respond to the complaint. And so I was hoping that we could put together a letter, or maybe we should take a vote to see how we stand with regard to whether you believe that the board members believe that that we had, in those two instances, violated the open meeting law. So with that.
Before we do that, I
Okay.
just want to make a point, that this is not directed at the Board of Health. It's directed at me. And I am the person that, I don't accept that I violated the open meeting law. So regardless of what the Board of Health votes, I am going to fight this if I have to go and have a meeting with the Attorney General's office and produce the evidence that I did just now. I would like the Attorney General to tell me whether I broke the open meeting law or not.
Okay.
That's my feeling.
Tracy?
I also want to make the public aware that in addition to the September 8th meeting, when Mr. Crowley stormed out before the meeting was adjourned and made disrespectful comments based on it, that he also attempted to reduce the number of members on the Board of Health from 5 to 3, so thereby trying to reduce. So this has been something that has been going on ever since the mask mandate, and the Board of Health does not fall under the jurisdiction of the Board of Selectmen.
Okay.
That we are given powers not through the Board of Selectmen, so I don't understand. Mr. Crowley has no professional interest in this. This is a vendetta against members of the Board of Health.
Okay, I think there's two issues here. One is the relationships that we have with the select board, and the second issue is whether we violated the open meeting law. So if we could separate those issues and concentrate on the complaint regarding the open meeting law violation, I think we better serve that way. So on that issue then, I would like to take a vote or give direction to me, because I have to respond to this complaint to the Attorney General's office. So do you think a vote would work? Or do you think that it's just being incumbent on me to write the response? What's your sense?
I would make a motion that John Sullivan did not violate the open meeting law in the communications of May 13th and May 16th. That's my motion.
Can I ask one question before we vote
Yeah.
for clarification? You were talking about intent to evade, is that?
Yes.
Is that right?
It's whether it's intentional or intent to evade. The right out of the regulation, right out of the law. Courts have held that the open meeting law applies when members of a public body communicate in a serial manner in order to evade the application of law.
Okay. Thank you.
I don't think that, oh, okay.
And I read that too, and I have the open meeting laws, I just didn't notate it.
Yeah.
And that was one of the things I
Okay.
also agree with.
So let's put it, as opposed to having, well, is there any discussion on John's motion? John, you want to repeat that motion again, please?
The motion would be that the Board of Health agrees that John Sullivan did not violate the open meeting law in the email communications of May 13th and May 16th.
Okay. Do I have a second?
I'll second.
All right. Let's have a vote.
All those in favor?
Oh, yeah? Tracy?
Aye.
I abstain. I can't read what was in someone's head when they made a decision. I believe specifically the complaint about the mask was in substance an open meeting violation, but I don't know. I can't say with confidence that you were trying to evade a law, so I abstain.
I believe that it was an unintentional violation, but I also believe that there was no intent to evade, so I'm in agreement that the board should stand and defend.
And I can vote on my motion too, right? So,
So we have did you record that, the vote?
It's four,
Yes.
for one abstention.
Okay, all right.
I'd like to propose we all retake the open meeting laws training.
We can go online, and, in fact, I did. I read the law, and then I looked at the most frequently asked questions. I reviewed those again, and I think it wouldn't hurt the board to, again, look at that. I think that we have to be particularly concerned about is this serial manner in communications. I think it's incumbent on us not necessary to use the West Boylston Board of Health to communicate, especially on things that are proposed before a board meeting.
so I would propose that one way to deal with that in I think, a more effective manner is that any email that gets sent to the board as a group is first passed from Maggie to you, and you're the one that says, yes, this should go to the whole board.
Okay, yeah, I think
I
that,
know that puts a little more on you.
No.
But that will prevent all of us having to answer or read the emails where we might make statements back, again, in an innocent manner with no intention of evading the law, but somebody who is sitting around thinking about open meeting laws may use that as evidence, so.
right.
The other suggestion I made is that maybe there's a folder, and each week, on Monday, is, whatever Monday was this week, the 11th, the week of the 11th, and then everything that Maggie gets, she just uploads to a folder. Because when you get an email, your natural inclination is to read it and comment. And so if it just all went to a folder, and we had 52 folders for 52 weeks, you could review it, and she wouldn't feel like, did anybody get this? Is anybody out there? And we wouldn't feel like, here come, I get, every day, I get 5 or 6 emails. I had to pay for additional storage because I have so much Board of Health email. And I just think it would be so much, and then you can we all go to the folder, we review it in our own good time. If there's something that we want put on the agenda, we put it on the agenda.
It has to go through the chair. Yeah. Yeah, I think that's a good one.
That's a good idea.
Technologically, I'm not understanding the folder thing, but I get it. But I'll learn it, and if that's going to work and get us out of hot water, that's fine with me. So with that cured, then I will advance the decision of this board to the Attorney General's office, and we'll wait to get their response.
Good.
Okay?
I'd like to see what you draft, just, since,
Yeah, well-
again, it's my name that's on the list.
No worries, John. The whole board will get it.
'Cause there is one word in there
folder.
about fines, FINE, which I believe is dollars.
Yeah, yeah.
And I don't think you're paying me enough to cover my fines.
Well, yeah, we don't get a lot of money here. We can't spend it all in one place anyway, so. Okay. That concludes our discussion on the open meeting law complaints. Tracy had asked me to put a discussion of anti-harassment and code of conduct policies for adoption in West Boylston. So Tracy, you have the floor. I might add that I met with Mr. Purcell about this today, and that is about the anti-harassment and code of conduct. And he wasn't sure whether that exists or not. I went to the website on the bylaws. I didn't see anything in the bylaws, so, and I'm not sure that this the place to have this discussion. I mean, you're welcome to discuss it, but I think you need to go to the town administrator or the bylaw group.
Well, this came out of, I'll just give you a little bit of background. This came out of something that happened back in August of 2021. I believe August of 2021. And yeah, I'm starting to lose track of time. And I had spoken with Nancy Lucier about it, and I said, I feel like we're being harassed as a board, and I want to know what, if you have a code of conduct or anti-harassment policy. So she sent me policy A9, adopted 2/17/2010, Town of West Boylston, Board of Selectmen policy, and it's board standards of conduct. And this is, I have this from, and then she also sent me a harassment, but it looked like it really pertained to schools, K through 12 anti-harassment, which again was quite old. And through some other work I was doing, we got issued this draft of best practices for a code of conduct policy for town elected and appointed officials by the MIAA, Risk Management, Massachusetts Interlocal Insurance Association. And they had a draft. And the purpose is for towns to recognize that all individuals elected or appointed by the town must maintain and enforce respectful discourse with their fellow elected or appointed members. And and it goes on. And I believe that we're supposed to represent the town and the community, and we can't expect the public to come to our town meetings and treat us respectfully when there's disagreements between boards and we're openly, I feel, harassed. And I've experienced this myself on several occasions when I've gone to the Board of Selectmen meeting innocently, when I didn't know anything about the Board of Selectmen. And so I spoke to Nancy about it, 8/6. I sent her what I had for the anti-harassment and draft, including sexual harassment. And harassment consists of unwelcome conduct, whether verbal or physical. Okay? And nothing became of it. And then about a month ago, I attended a Board of Selectmen meeting talking about hybrid meetings so that the public can attend meetings in a hybrid manner, not time delayed, and they can actually be engaged because we still have COVID going on. Not everybody wants to come to the room. And I said, by the way, I would like to see this addressed. And thank you for coming, and nothing has happened. And now we have another open meeting complaint, and I'm asking this board to make a motion that we formally request the town administrator to look at an up-to-date code of conduct policy and anti-harassment and anti-discrimination policy.
Sure.
Sure, seems reasonable.
Make a motion.
Okay? So I'd like,
Or do you have?
Before I make a motion, it kind of seems like a knee-jerk reaction to getting caught in an open meeting violation to say we're being harassed and not call for a
it does not.
policy.
It absolutely does not. I asked her 8/6/21 about
Tonight's
it.
meeting, not.
No,
8/6.
this has been ongoing, and I spoke to her directly. I spoke to the Board of Selectmen a month ago when I attended a meeting when there was no open meeting violation on the table. I have been committed to this since August of 2021, when I asked Mrs. Lucier about it, and I've gotten nowhere, being just, oh, by the way, oh, I've emailed you, oh, I emailed this to a member of the Board of Selectmen, could you, bring this up or consider this? I went to the meeting and I asked for it to be, considered. Nothing's happened.
Okay.
I'm sorry for your experience.
Yeah.
Thank you.
Yeah, I think it doesn't matter. I know that our relationship sometimes with the select board has been stormy, but if there's a need for this policy, then I don't see any reason, I don't think there's ever a good time to do it, so this is probably the best time. So I'd ask that you make your motion, and then we put it to a vote, and we go forward. I might add that the present town administrator probably won't take any action on this, because he's a placeholder.
He's an interim.
And that we would probably want to have a discussion with the new appointed.
Yeah, I would suggest that we actually bring this, first of all, that Tracy disseminates this to all of us. And that we, as soon as the new town administrator is in place, that we have the town administrator at our Board of Health meeting and bring this up as one of the topics that we are interested in and seeing put in place.
Is that in place of a vote on this tonight, or is that?
I'm happy to make a motion that, that we move forward with getting a up-to-date anti-discrimination and anti-harassment policy, as well as a up-to-date code of conduct policy for the town of West Boylston, encompassing all boards, town employees, and people, dealing with our boards.
Right, okay,
Second.
all right.
Who's
Then
second?
let's-
Who's second? I'm sorry.
John, second.
Okay.
Let's put it to a vote. Tracy?
Aye.
Aye.
John? I'm an aye.
No. I think this is a town meeting issue, not a Board of Health issue.
Yeah, well, I think it's an issue for all of us. But, no.
4 yes.
Okay, I know that Steve had raised his hand earlier, and I'm sorry,
Quite all right.
in the moment, if you want to address the board? Did you want
Sure,
to,
well,
would you give your name and,
Yeah.
give me your name?
You've been voting the way I was hoping you would vote. I just wanted to thank Dr. Sullivan, Tracy, you. I know Tom from soccer, 100 years ago. But,
Chris.
Yeah. Hi. So I just want to thank you. I think you're doing the right thing. The mask mandate was obviously right on back when you put it in. I don't understand, the pushback. I do understand the pushback, but I don't agree with the pushback. I think whenever there is a health versus business decision, go with the health, right? Go with the health. I had COVID a month before that open meeting. I wore a mask, okay? I really, I took it upon myself to walk in there with a mask. It was stuffy. I put the mask on my chin after the first hour because I couldn't handle it anymore. I wish it was outside. But you guys are doing the right thing, and I don't understand the attack that you seem to be getting from a couple of the select board members. I think they're nickel and diming you. Maybe they're right. I went and I read the bylaws too on about open meetings, and yeah, unintentional open meeting violation is how I interpreted it.
Yeah.
How I interpreted it.
Okay.
But you know what? Keep me alive, keep me healthy. That's your job.
Okay.
Thank you very much.
All right, thank you, Steve.
you.
Thanks a lot
Thank
for
you.
sharing that.
Thank you.
That you had to take the mask off, that you voluntarily wore because you couldn't participate with the mask on is the whole point about what the debate was. So thank you very much for sharing that.
But you know what? If I was contagious, I wish I was sitting right behind somebody that was an anti-masker.
Okay, we don't need to have that, okay?
Because it's not about me, it's about the other person. It's about the other person. I'm protecting the other person, not about me.
All right, we're not gonna have that debate. All right, we're done with that debate, okay. All right, I guess the next thing on the agenda is the board reorganization and the signature to sign the authorization form. So, I've been the chair for a very long time. I don't know how many years, and I think it's time that I no longer serve as the chair. I would like some other persons to step up and to become the chairperson. So let's have that discussion.
Thank you, Bob. I want to say thank you for your service, because you have really, I think you told me last year it was like 21 years or some crazy number, and that's a very long time. So thank you.
Yeah, and I just think that it's time for a new leadership, a new person to get involved and to step up. So I'm asking for someone to be nominated for the chairmanship, and then vice chair, and then clerk or secretary. So, do I have anybody that wants to step up?
I'm too new at this.
But you're qualified medically.
Yeah, sort of.
Chris?
How many hours a week do you have responsibilities?
It depends on what's happening in the town. Probably, I don't know, how many hours? How many hours?
A lot,
Yeah.
a lot.
Well, I mean, you have to count the times that we we text, email, talk on the phone. It's hard to say.
Yes, could I guess?
Yeah,
At
you-
least 20 hours.
Well, I don't know whether it's 20
No.
hours, but it depends on what's happening in the town, and it depends. The last 2 years was a lot of effort, and I just think
Maybe
that.
10. Maybe 10? Does that sound more
Yeah,
reasonable?
whatever, so, it depends, Chris, I don't know.
I mean, I'm certainly not the first in line for
Okay.
this, certainly being also new to the board.
John?
If you twist my arm, I'll do it.
I'll twist your arm, I'm gonna twist your arm.
I think John should be, with all due respect, I think John, he's been on the board the longest after Bob. He is by far the most knowledgeable about COVID, and it still exists in our community, and I believe he,
And Chris will teach me about open meeting laws.
Perfect, we'll be a great team, John, great team.
and I'm happy to stay on as the vice chair if the,
Okay.
but I do not want to be the chair.
I will say that I will continue to help with Maggie, but I will not act
And
as,
slap me in the side of the head when I'm out of line.
yeah, be glad to. And that's a head that needs some attention. So I need someone put it in a motion, and we gotta vote on it, and so
I'd
let's,
like to make a motion that Dr. John Sullivan become the chair of the West Boylston Board of Health, and Tracy, I can't motion myself to be the vice chair, so
well,
we'll make that motion and then make a separate motion for the vice
all
chair.
right. So do I have a second for John to be the,
Right here.
okay, so all in favor?
Aye.
Aye, okay, so it's unanimous, right? Okay. Now, vice chair.
I make a
Tracy,
motion that Tracy be the vice chair.
do I have a second on that motion?
I'll second that one too. That's all I do.
Okay, so let's have a vote?
Aye.
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 Aye, okay. Clerk,
What's the effective date?
right after this meeting.
Tomorrow.
Oh, you can take the rest of the meeting.
I'm going to Block Island on Friday, so when I get back, okay?
Okay,
August 1st, how's that?
August
Yeah,
1st, okay.
August 1st.
Okay. All right, so we need a clerk.
Have we ever had one?
We're supposed to have one.
Oh, okay.
I thought that was you, May.
What does the clerk do?
Well,
I thought it was Maggie too.
I didn't even know we had one.
I know,
I
right?
haven't had one since I've been here.
I don't know what the role is.
I'll do it with the same job description,
Okay, that's
with the
good.
same job description.
What's
Okay,
that?
with nothing, right? No.
Okay. All right,
mean-
so if we have a clerk, if there is a clerk
Want to be
position,
the clerk, Bob?
no. No. So,
I just wanna know what it is.
All right, we're
before
gonna
I
find,
wanna know what it
no,
is
we'll
first,
find
yeah.
out what it is and we'll give it to you.
Okay, all right.
Okay,
I'd like to know what it is before we vote.
Okay.
all right, so that.
We'll abstain from the
Yeah,
clerk position
yeah,
until we
until we
have
have-
an
okay.
accurate job
Okay,
description.
that's
That's
okay,
smart.
we'll take that up at John's next meeting.
And we won't email about it in between.
Yeah, exactly. Okay. So we also have to have, let's see, this is the agreement, so authorized signatures for
Yeah, there's
2020.
2 copies. I
So
need
there's
to
2 copies.
get
One,
if you
two,
sign
three.
both.
We've all signed so
Well
far.
signed.
I didn't
Sign
sign.
both?
Yep.
I didn't sign.
Yeah,
Okay.
you're the
I
only one.
am the only one.
Sign off.
I'll sign.
Okay.
Okay. Just to keep this thing moving, what's the next thing that we have is the 2023 intermunicipal agreement with the Worcester for inspectional services. The Board of Selectmen has signed another agreement. We're gonna participate in the, again, in the alliance. They have voted to use federal money to pay the increased premium, or the increased
The
billing
difference.
for the services of the alliance. So if you want to see a copy of that, I'll get a copy out to everybody. But they provide, well, I guess you're here, so you might as well tell us what the alliance does for the West Boylston Board of Health.
This does not include, does not include Title V stuff, it's everything else, right?
Well, no nursing services.
Well, no nursing services. right?
Okay, so what does
So
the,
I thought, just before we go, I thought we were actually going to look into including nursing services.
I did actually speak to them about that.
Oh, but it didn't come.
They were in the process of hiring a nurse, so they didn't have this. I talked to Karen Clark, who was the director, or is still the director until the end of the month. But yeah, we can still look at that, but they weren't prepared to take us on when I spoken with Karen maybe a month or two ago, so.
Probably a little longer. I know you've spoken to her previous, but I know that our chief of public health nursing retired. We did onboard another public health nurse.
You know what, you need a mic. You need to come up, let's give her a mic.
State your name, your position.
Julie Bernard Stalin, Regional Public Health Coordinator, City of Worcester. I knew, Pat Bruckman had retired. She was the Chief of Public Health Nursing. We were able to fill another position for a public health nurse. And right now, I think we have 1 or 2 vacancies, so we just don't have the manpower to tackle anymore for public health nursing. And that was at the time when you were speaking with Karen.
Has that situation improved? Do you have enough nurses now or not?
So it is, I believe it's, the job is posted
Okay.
through Human Resources. There's another vacancy, yes.
So we can discuss this, the nursing contract in a future meeting, because I don't think they can take us on at this point. Presently, we receive our nursing services
Yeah.
through the town of Sutton. We've been well-served by,
Cheryl Berwinski, yes.
by Cheryl Winsky. She stuck with us, stayed with us for the whole COVID emergency. I was able to call her late in the evening, or I call her early in the morning. She responded to all the vendors in town, all the restaurants, the school department. She worked with the school nurses, and she was wonderful. And it was, I know for her and for the Board of Health, it was stressful sometimes, because we didn't have all the answers, and we were waiting for guidance in some cases from the state or from the Alliance. So right now, we will continue with that. So what are the other services that we contract with the,
Emergency preparedness, community health, environmental health.
what's environmental health?
That's like 9 pages of stuff that I do, but I do anything from routine food inspections, foodborne illness complaints, food plan reviews, We also do tobacco, so we do all the tobacco inspections for the community. We do camp inspections, but it's just not going out and do camp inspections. It's reviewing all their binders to make sure they're following all the regulations. And then we go out and do camp inspections. We do semi-public and public pool inspections. We do tattoo, so tattoo inspections as well. All of the applications for the renewals, I or Micah will typically review to make sure also that we have all the necessary paperwork that we have. We do housing complaints. We do nuisance complaints. So we have to follow up with inspections. So whether we're doing a housing complaint, write order letters. If there are any orders to correct, we have to notify the landlord. We also notify the occupant as well, and they receive a copy. Then we have to follow it through until such time all the orders have been corrected, all the violations have been corrected. Nuisance complaints can be anything from air, water, noise, dust. We also witness soil testing for Title V for septic systems. We review Title V inspection reports. We review septic design plans that are coming in for either new construction or septic repairs. We do component inspections if they have a single component that needs to be repaired due to, whether it's deteriorating, which would be a distribution box or a septic tank. We do a tank abandonments. We make sure that they are pumped dry. We conduct at least 3, sometimes 4 inspections for every septic system that goes in. We do a bottom inspection, component inspection, finish grade, stabilization. We also review all the septic as-built that come in, which means that for every septic system plan that I reviewed, for every installation, with all the inspections that I did, it is me, as well as the engineer will go out and do their inspections. He's going to make sure that the system was installed the way it was approved and the way he designed it, but also what was approved from me. He'll turn in another plan, which is called an as-built, which will provide the existing proposed plan and an overlay of what was relocated and shot, just to make sure that everything, all the elevations are put in correctly. From there, I will review that, sign off for a certificate of compliance, and then finally we're done with that piece. We do after-hours emergencies, whether it is a food truck accident, tractor trailer accident, if it happens in your community, fires. Yeah, after-hours fires. We do have a duty officer number 2, so we are available 24 hours a day, 7 days a week. We do a lot of education. We educate a lot when we're out in the field. So like our main goal is to get people to comply and not punish. So sometimes it's just educating people and letting them know that, hey, you really can't do this. And we show them the right way.
So,
This-
having said all of that,
I have a lot more.
you want to discuss your report while we got you,
You want me to just go to that?
just go through that.
Okay. Actually, I'd like to bring up one thing, if I may.
Yep.
So the Coalition for Healthy Greater Worcester has updated their CHIP website. And what I'd like to do is have the community health team come in to the next Board of Health meeting, if it is okay, in August, to talk to you and unpack the 2021 through 2026 Community Health Improvement Plan. And this was created with 4 principles in mind: invest first in the community, elevate, listen to, respect the community's voices, eliminate gas routine services, and honor trauma-informed approaches to care and equal measures. I'd like to ask the board if it is okay to have one of our team members from the community health team come in and talk to you about the CHIP at the next meeting.
Mr. Chair.
Or if you'd like, I could have it done in September also.
Perfect.
September?
Yeah, let's do September.
Let's do September? Okay. So we can invite community health team in September. Also, HMCC for West Boylston. This is the beginning of the new grant cycle. And right now, they're currently awaiting their contracts for renewal for HMCC.
All right, what's HMCC?
HMCC is Health Emergency, it's part of so we are part of the FEPS Coalition. So that is the Public Health Emergency Preparedness. The HMCC is the grant holder for
I'm for the
the
benefit
FEPS.
of.
Okay. Actually, Tom
That's right.
Tom's been
actually
attending.
goes to that as well.
Yes.
What they're looking for now is a renewal letter annually for the person that can vote on your town behalf, and then to have an alternate. So they're just looking for a letter from the Board of Health again this year, For-
What's the date, start date?
July 1.
Okay, July 1.
But we did one last year.
Yes, we've done one.
Let's do-
Last year I was primary, and
Tom.
Dr. Mullins
Right, but that
was
wasn't in Tom's wasn't in
I wasn't in there too.
secondary.
But so
He's
we
great,
can
he's
do a
funny.
letter that makes, you're gonna be primary again, Julie?
Sure.
Okay, and Tom, you're okay to be second?
Secondary,
All
sure.
right, so they need a letter, and who does that go to, Julie?
You can email it directly to me, and I can get it over to Shane Wagner,
Okay.
Pam, or Alyssa. Or if you have,
And it's same format that we
same
used
thing.
before?
Yep.
All right. That's our representatives at the,
that's,
yeah.
Alyssa is your Chief of Emergency Preparedness. Okay. And then the food inspections that were conducted were Table 12, the Manor, S&S Farms, the retail as well as the deli. Major Edwards Elementary, West Boylston Middle and High School, Brown Rice 2, Ollie's, Subway, Living Well Adult Daycare, Day Health Care, Schoolyard, Nola's, WB Cinema, West Boylston Seafood, Cumberland Farms, Steve's Pizza, camp inspections, Camp Woodhaven. I spent a lot of time up at Camp Woodhaven, as well as conducted their pool inspection, because they're opening their pool for the campers. ABL Dance, they had a camp inspection as well. Soil testing that I have scheduled this far from the applications that I received were 13 Winthrop Street, July 26th, and then 41 Campground, August 8th. I did offer earlier dates, but they couldn't do them. The update on 202 Prescott is that Mercurios will be installing the system, and they will be installing it in the fall. And then came in and reviewed Title V inspection reports. Also, we know that in Massachusetts now, we are I believe we are in the level 2 for a significant drought. That just came out today, so conserve your water usage.
I sent that report out, and forwarded it to you this evening.
Okay. Is there anything you want to tell us about the Alliance? There's been gonna be some major changes there, right?
Was an email sent out? All right.
I didn't see that.
Well, I think Karen sent me an email.
She sent you an email. So Karen Clark, my Director of
Oh,
Public
that's
Health,
right.
who has worked for the city for some 22 years, has worked in multiple departments, whether it was in the senior center, tobacco, community health. She actually, now currently she is our director who has transformed our alliance to what it is today. And she has left, well, she's leaving the city of Worcester, and she is going to be the assistant town manager in the town of Millbury. She will be starting August 8th. We are very proud of her. We're really happy for her and excited for her new endeavor. She deserves it, and she has worked so hard with her team. And currently, we're in the middle of doing like a transition. We are having an interim, hopefully be appointed an interim director. With our group, we have a lot of different chiefs, so everybody's in charge of their divisions. So it runs seamless. So day-to-day ops will still go on. And we are just now going to be looking for a director of public health for the city of Worcester for our group.
Are there inside candidates?
Perhaps there is one interim deputy director that may or may not transpire. She's amazing. She has everything in place. We've been working, we had a meeting, a chiefs meeting this week. Everybody has their part. Everything's pretty much going to be handed to the next person in line. And, staff is excited just to see what transpires when the next person comes in. Karen built the alliance up to what it is. And, I've noticed, because I've been working with the alliance since the first director vacated, and now, Karen ended up becoming the director. I have noticed a significant amount of changes, and I'm actually proud to work for the alliance, knowing what she has been capable of. She's a leader. She'll be definitely missed.
Yeah, I have to say Karen Clark and I go back from day one with the Alliance, and she was tremendous, always answered every email, always willing to help us in any capacity.
She was very
Generous.
supportive to us.
Very
Generous
public,
with her time.
Going through the COVID pandemic.
Oh, yeah.
She was very supportive.
very supportive.
And we needed support.
And she's very supportive of the boards, and, she communicates effectively through and through on a daily basis. She is right there to answer any question. And if she doesn't know the answer, this is what's great about her. If she doesn't know the answer, she'll tell you, I don't know, but I will get right back to you. She gets the answer, and here you go.
An example, can I give an example, recent one?
She's stellar.
Yes, recently, we were dealing with the fact that our COVID funding was, we had some leftover COVID funding from the first two grants. That was, we were told that had to be returned to the state. And we were given a third grant that we pretty much has run out of, and we're gonna be still getting nursing services that we have to pay for that we don't have in our budget. So the grants have covered our public health nursing services for COVID. We continue to pay them out of our funds for everything else, but the COVID funding, the work that the public health nurse does is a lot. And so I sought her help in finding out whether those two earlier funds that we have some balance left in could be used for our continuing needs, and she facilitated us, that communication.
Yeah.
And we are going to be able to use those funds that were left over on an ongoing until they're used up, basically. So
Yeah,
for now, we're doing a little better than I thought we were, so that was a relief. So she really she helped facilitate that.
Yeah, it didn't hurt that Sam Wong, who had to make the decision, was previously on this board.
Was he really? Oh,
Yeah.
isn't that something?
And he was also, I'd worked with Sam on another job years ago, so that worked out well.
Yes, so that's just an example, but she was very helpful, when I asked, she followed, I have to say, she's somebody who, like, you have a question, she responds. She doesn't leave you hanging.
Yeah, okay.
Anyway.
Did you-
So knowing past history as well, I know that you will be informed, the boards will all be informed, Maggie, I know that the admins will all be informed as to, who, for the chain of command. I know everything there'll be something prior to her departure. I'm very excited for her,
Okay, so does that conclude your report?
and I'm smiling. Yeah.
And just to be clear, what Julie described as all the responsibilities that our inspectors have,
That's only a little.
yeah, that's not, yeah, she was, but yeah, that wasn't even all of it. But I'm just saying, she gave an overview, but the Title V stuff is billed separately. The IMA is for everything else.
Right.
The Title V stuff is billed per,
unit, or.
yes. So
Yes.
just to be clear on that, I just want to be clear on that thing.
Okay.
So it would be soil testing, and then it would be plan review,
Right.
and then all the inspections compiled into
Inspections,
one.
right.
Yeah, we charge the homeowner for those.
Yeah,
It
it's
goes
what
into
comes
our,
in.
goes in our fund, and
Yeah.
then we pay out the,
To the inspector,
the
yes.
inspector at the end. So it washes through the,
Yes.
our
The
account.
septic.
No pun intended.
Okay, I guess that, I'm gonna move on then to the, review, changes and sign the tobacco regulations, discuss publication notice, et cetera. So, who wants to lead that discussion? Okay,
Didn't we already do this?
Yeah, I thought-
we went through
I
it, there
thought
was
the
some,
only thing we had to decide was,
if we're gonna do it, right?
Well,
We
we're
need
just
to take a
gonna-
vote.
We're just gonna vote on it.
yeah.
That's right.
We're gonna think about it, vote on it.
Yeah, okay, so, basically though, my understanding is that these regulations come down from the state, and,
There were a few tweaks, which we went through all the tweaks at the last meeting.
we've done that,
So now it's just
Right.
vote to
Right.
approve as written.
right. So, do I have a motion to approve the regulations of the West Boylston Board of Health restricting the sale of tobacco products? Do I have a motion?
Yes, I'll make the motion.
Do I have a
Go
second?
a second over here.
Is there any discussion? Do I, let's, do
All
I
in
have a
favor?
vote?
Yeah, hey, aye.
Aye.
Okay, I think it's great.
Aye.
Lovely. And it
That's
has the
unanimous.
date, has the time period in it that,
We actually have to put these, we have to advertise with the effective date will not be till maybe a
week
month.
after,
a
a
month-
month after
a
the
month.
publication.
So, yes, we have to actually, on such and such a date, today, the Board of Health voted to enact the regulation. And then the relation, it tells what the regulation includes. It'll go into effect 30 days after the date of publication in the local paper. So what we have to do is, we have to decide on a date,
Well,
for
let's give
publication.
ourselves 30 days anyway, so you can get that into the paper.
All right, so within the next 30 days, get it into the paper, and then we'll go from there?
Well, we know, we want an effective date. So it's gonna be September
1 month
1st.
after the publication.
Okay, so as soon as I can, get the publication
As soon as
done.
the
All right.
Publication would go in 1 month
Okay,
afterwards.
yeah, there's a lot of stuff that needs to be done, so, you guys have to sign that regulation, there's signatures on the bottom, the back, the last page, and I have to email that signed regulation to somebody, to DPH, somebody at DPH.
Cheryl Tangri, I think.
Yes, sure.
And I have to mail it, I have to mail a copy of the signed regulation to DEP, and a letter on Board of Health. I have all these things to do, so I'm gonna need some help.
We'll get you through it.
Yeah,
This is part of Bob's.
it's a whole list of stuff I gotta
Yeah,
do
this
with
is Bob's pending. This is-
But if I don't
He's
get
gonna
it
take
done,
care of
John,
this
you-
by
But
August
then,
1st.
yes, there we go. Yeah.
There
you go.
She'll have all the templates.
Well
Oh.
played.
All right,
Yeah, she'll have that also.
Okay.
okay,
Okay, you just email
thanks.
her.
I'll just let me write down Carrie's name on that.
Just email her.
With that, then we have the office report, which is gonna be very brief.
All right, so just, just real quick, the COVID tests, we have to decide on the distribution of the COVID tests. Can we,
How do you want to
I,
distribute them?
Didn't we ask the select
they
board?
said they had no,
They
we can
don't
do it
care.
whatever
They don't care.
way we want.
Yeah,
Good,
yeah, so I think we should leave some at the senior center,
yeah.
some at the pantry, like
Yeah.
as we did before. Get
Housing
some,
authority?
get some over to the housing authority,
Wherever Bob wants them.
and we're
All
out.
I would contact the churches, ask them how many parishioners, and have them come pick up their boxes here.
Yeah, because we have over, what, 1,300?
We have, yeah, about
I
that.
would do it
But-
per case.
What is the outdate?
There's
Do
90
you know
per,
the
90 per
outdate?
box. What?
The outdate on the boxes.
Expiration?
I'd have to look at that.
Can we look at that, and if it's like a year from now, let's save some here,
I don't think it's that long.
I think it's 6 months. It was December,
December?
I believe.
Yeah, actually, I have some, you want me to go grab one from?
No,
grab it?
that's fine.
I'll just let you know, I'll email you.
I would just keep at least 100 here.
Well, one box holds 90.
Okay, so keep
Keep
one
one
box.
box.
Keep one box.
Reserve.
All right.
Because then we have the ability to respond if we, there's an outbreak someplace,
So I'll go over with Bob where we want to distribute them to, and I know that some of our emergency responders have asked for them in the past, and I talked to
Fire department.
Tom,
That's
and
perfect.
he'd like to have some because he thinks theirs are expired, so,
Yeah, they do expire,
yeah, so we need to find out like our fire and
please.
police, and see if they have needs for them.
Okay,
Go ahead.
all right, what else? Oh, I'm sorry.
Can I make a suggestion?
Sure.
Instead of opening the box and giving 30 kids, give them a case.
Right, well, we only have so many cases, so we have to just be careful.
I know, but you have a lot of cases.
Well, if it's
16
90 in a
cases of
box,
90.
yeah, it would be like 15 cases.
90 on a box. So give them a box.
Just a box, yeah,
Yeah.
yeah.
Yeah,
Because they could be testing.
And they'll be circulated.
I'm gonna keep a box here for people that have.
Yeah, you
Yeah,
should have
all
some,
right.
some here that if someone
All
shows
right,
up at the
so
health office looking for
Maybe
one,
we
we
can
got
sit down and decide where they go,
Yeah,
Bob,
okay.
okay? I just wanted to bring that up okay,
that's
so.
good. Thank
All
you.
right, so, there is no CMRPHA report. Julie already gave the local report, and I just wanted to, go over real quick any new situations we have. As we said, 202 Prescott, Mercurio is gonna be doing that work in the fall. We've got the property on Prospect Street has been sold. It had plans for a new septic system, but apparently they didn't do the upgrade, and they've sold the house. So hopefully, I don't know how to follow up with that, is that the new owners know
We
that they have to do it.
we got the inspector right here.
All right, well, somehow we gotta find out if they know we have plans and everything for the new system, but the previous owner did not wanna do the upgrade before it was sold, so that must be in their agreement, I hope. So I've followed up, let's see, just want to follow up on the missing documents for 160 Prescott. The owner called. I've also gotten confirmation from the neighbor that the work was done, but we have no paperwork. So I've been trying to follow up with potential, the owner gave me the names of different people that might know that worked on the property. And I've been trying to get in touch with them, just so you know that I'm following up on that. As Julie said, she's following up on the projects, the septic projects, 41 Campground and 13 Winthrop. And 13 Winthrop was one that failed, so that one's being replaced. I wanted to note that Mr. Barrell, Bob went down to Shady Lane to look at the report of possible sewage in the stream there, and he said the stream is dried up and there was he noted no evidence of any contamination. Nothing's happening with the Bethlehem Bible Church. And we just sent a letter out to the owners of 104 Shrine because we have very mixed information about what happened to the old septic tank when they hooked up the sewer. So I've sent a letter to them, with Julie reviewed, and, so hopefully because I talked to the new owner, and he said he was gonna follow up and do an exploration to see if it had been, abandoned appropriately, the old tank. But we had mixed information in different, areas, so he had not gotten back to me, so I sent him a letter that he needed to do that. And that he could connect with Julie for assistance. Let's see, we have 129 permits to date for 2022. There's a new tattoo practitioner at Heritage Road, which Julie's gonna review his application. He used to be with the other tattoo parlor in the past and appears to have all his stuff in place. And I believe that's it. Basically, just our bill approvals are as usual for Worcester DPH and for nursing services. And I already talked about the funding. And I think that's it.
We need a date for our next meeting.
Julie has a question.
I do have some questions. 160 Prescott, what paperwork?
There was when I was looking at the contamination for that stream, I was looking through all the properties and that, the files for the properties along that route of that stream to see if they could be involved in the contamination that was reported, because that stream runs by that house on Shady Lane and then into DCR property, which is a big property in the back, and all the houses along Prescott abut that property. I didn't realize at the time that the stream ran in the other direction. So I wanted to check to see if the properties if there was any problems. And then when I found that property on 160 Prescott, they had a design for a replacement system because the system had failed, but there was no paperwork that showed that they actually did the work. So there was no certificate of compliance, nothing, there was nothing in the file that showed that the tank had been installed.
So you sent the complaint over to us, and we investigated that complaint as well, Micah and myself.
That's the stream you're talking about, right?
Correct, and it was unfounded.
Right,
So kind of should have been.
because the owner called me back
Right. but
again, and so
again,
Bob went over again, so.
Right, so we talked to conservation, Micah was speaking with the owner on his property, so we kind of handled that one too, just like you, Bob, and we closed it out.
Yeah, it's a seasonal stream, and when I went there, it was dry.
Right, but DCR had said something about getting it tested or something, so that's why I was following up, that was their
Well,
input.
if they want to test it, they can
Let
test
them
it.
test
So,
it, yeah.
and the
Yeah,
other
test
thing
it.
too now, to chase paperwork from God knows how long, how long ago was that?
I can't even,
So
yeah.
chances are if they sell their home, they're gonna have a Title V inspection, so I think I would kind of put that one to
Well,
bed.
when they sold it, the owner that owns it now is the one that had bought it when the system was replaced. But there was,
So they should have that at their closing with their attorney.
he doesn't have anything, so he called me to let me know, though, he
Right.
was aware of it, and he gave me the names of some of the people involved in
Right.
the work, so that I could follow up and see if I could get paperwork to confirm it, so it'd be in the file.
How long ago? Years?
Yeah, it's been years.
So then there's no sense in getting the paperwork if they don't have it, because it's not valid. If, like, say, they didn't turn in their paperwork and their certificate wasn't signed by a board of health, by somebody here, it's not worth it to chase it at this point.
Okay, well, at the time, I was doing it in pursuit of possible contamination, and I didn't have any record that it had been
So
done.
what's the resolution?
So resolution is just let it be
It's
right now.
unfounded.
Right, okay.
Right?
I
And
don't
the
need-
resolution is when we go out and do our inspections, and even if people keep calling after the fact, because we still go out and investigate, if it's unfounded, it's done at this time. And we do work alongside with other departments as well. So we did work alongside, I had the day off actually, and I had a very lengthy conversation with conservation, one of the members.
Right.
So it was kind of, it's
All right,
Yeah,
unfounded.
yeah, okay.
okay.
It's good.
All right, so the next meeting,
August.
we have a
I
date?
don't have a calendar in front of me.
It's the 3rd, the 10th, and the 17th, but
Would be the 10th,
I can't come on the 10th.
okay?
Okay.
I can't do the 3rd or the 10th.
Okay, so
How about the 17th?
Okay.
Good?
17th?
Everybody good for the 17th?
All at the
Yes,
17th,
Thank you. So
6 o'clock
Thank
or
you.
6:15?
6
6
o'clock.
o'clock.
Or should I ask
Next
Colin?
meeting?
6 o'clock?
You know the
Yeah,
September
that's right.
meeting?
Oh,
It's
8.
his,
It's usually,
I'd ask,
baby now.
community health so we can get community health on the agenda in September.
Well, we would have to, let's see, September.
it's usually the second Wednesday of the.
Second Wednesday would be the 14th.
Okay, thank you.
Does anybody know what they're,
Don't even know if I'll be alive then.
There you go.
No, no, you're right.
Is it 6:15
One day at a
or
time.
Yeah, that's right.
6.
So September 14th, we're locking in?
Yeah.
Board of Health.
So I need a motion to adjourn?
You need a motion to adjourn. I'll make a motion to adjourn.
Second.
All in favor?
Aye.
It's
Aye.
unanimous. We're done.